Hi, I'm Dr. Shruti Mane. I'm an obstetrician and gynecologist and practicing as an infertility consultant at Motherhood Hospital, Kharghar, Navi Mumbai. So today's session we're going to talk about stress, emotional well-being and psychological effects fertility treatments have on our patients, and we'll be discussing about it in details. Well, stress and anxiety come as a part of infertility treatment. See, infertility treatments are quite tedious, and when it comes to patients, every patient has her own set of questions or her own set of doubts, and that induces stress and anxiety. So I always ask my patients to come and tell me that what is bothering them, what are the kind of queries which are lingering in their minds. I ask them to write down the negative thoughts they are having with respect to the treatments. During the next visit they come to me, they talk about it, they get their queries solved. Again they go back, if again they have newer doubts, they write about it and then they again come to me. So that is my way of pacifying my patients. What I suggest is mindful reading, reading positive books, reading books on infertility. A lot of influencers, a lot of authors have come out with books on their own fertility journey. So you can read about it. Talk to the patients who are going through the same process, your friends or your relatives who have gone through the same process. Write down your negative emotions. So start journaling every step, write down your positive thoughts, write down your negative thoughts as well, and meditation. When it comes to a patient's fertility journey, family and friends play a huge role. So, certain patients who come to me come from the strata where the family is not at all supportive. So, in such cases, I tell my patients to not, disclose what treatment they are undergoing, how many cycles they are undergoing, or what kind of treatment they are going to take from their doctor, because that is going to cause a negative impact on their mental health with respect to the treatment cycles. But when it comes to a patient whose family is quite supportive, whose family gets them to ask, doctor, look at her, what is the problem, we are ready to do anything for our child or our daughter-in-laws. For such patients, I tell them, communicate with your families, talk to them, and don't indulge yourself that too much into the treatment process. Your doctor is always going to be there with you, so you need to trust the process. Ask them to meet me personally on that day itself. So you shouldn't abandon your patient in such situations. Talk to them, listen. Here the key is to listen to your patient, what they are feeling, what they are going through. If they want to cry, let them cry in front of you, but explain them that this is not the end. It is just the process. You have to keep trying and eventually it is going to be possible.